so many people spend so many years in treatment just like discussing like what's underlying these intrusive thoughts, right? So I get so many people after they've been years of psychodynamic or psychoanalytic psychotherapy who like made very, very little progress. And in the course of just really just a few sessions, you see such major transformations.
Welcome to the Maximus podcast. I'm your host, Dr. Sepah. As a clinical psychologist, medical school professor, and CEO, I specialize in helping men be better in mind, body, and masculinity. On this podcast, I interview extraordinary men as a clinician would, hearing their come-up stories of how they became the men that they are today, and having them share their secrets of actionable advice on how to look, feel, and perform your best. Welcome everyone to the Maximus podcast. I'm very, very excited today to have Dr. Elliot Kaminetzky, who is a fellow licensed clinical psychologist who specializes in the treatment of OCD and anxiety disorders. And he's the founder of My OCD Care, a private practice that's catering to those things. He's also a parenting coach, husband, and father. So a lot of interesting things to talk about as related to masculinity. So Dr. Kaminetzky completed his PhD in clinical psychology from Hofstra University and completed a postdoctoral fellowship at Northwell Health's OCD Center. He is a true expert on OCD and anxiety disorders, and we'll have a really, really interesting conversation about how do we deal with stress and anxiety in a modern era where it's very conducive to feel that way, and what are appropriate ways of addressing and handling that as a guy. So welcome to the podcast.
Thank you so much for having me.
My pleasure. I always think it's so great to talk to fellow male clinicians. Unfortunately, it's rare things these days, but I think there's so much potential for, especially I think a male audience who it's kind of funny. There's like a Twitter meme that's going around right now that's like men would rather, I don't know, do X, Y, and Z rather than go to therapy, which,
right.
It kind of, I enjoy the humor, but it kind of kills me too, because I'm like, guys should go to therapy and coaching. But I think it's really, there's a lot of things. There's stigma, there's stereotypes, et cetera. And so I'm hoping that this conversation can help, open people's kind of minds and maybe even hearts to considering different options that are available to them. Because God knows that a lot of people have anxiety. So,
yeah, absolutely, more and more.
So why don't we start out with, we like to do this first segment focus on kind of making the man and kind of really getting to know our guests, which I'm sure you appreciate as a fellow psychologist. It's all relationship building, so to speak.
Yeah.
So I'd love to just learn more about you and introduce you to our audience. So. Why don't you tell me about your experience kind of growing up and what childhood was like for you?
Sure. So I grew up in Muncie, New York, which is a suburb north of Manhattan. And I had a really wild childhood. I was the youngest of 6.
Awesome.
And my dad was 45 when he had me, and my mom was 40. And by the time I was a teen, they just were like, here's the key to the car. do your thing. Just let me know where you are.
Yeah.
And I think that freedom is so rare these days. And I totally. Definitely took advantage of it. And then luckily, come college, I kind of got it together.
Yeah.
But I was very much into outdoorsy things. My dad took me fishing all the time.
Nice.
My friends and I, we had BB guns and crossbows, and we just really had a great time. And we would just go wherever. And once in a while we called home. There was before the cell phone era.
Sure.
So yeah, I had a really fun childhood with a lot of trouble, and it was just great. Very fun childhood memories.
Like classic Tom Sawyer, almost kind of childhood, which to your point is kind of rare these days. Well, I have 2 questions. So one, I'm actually really curious. I mean, you are an expert in sort of, anxiety disorders, and I guess this is the era of helicopter parenting, as they say. The idea of giving kids BB guns and letting them run around without supervision and cell phones seems, scary, quite frankly, to a lot of parents. Maybe it's for the best. Like, maybe kids aren't like accidentally shooting each other as a result of that.
Yeah.
But on the other hand, there is this concern that without letting boys be boys, they're not sort of developing and not testing their limits and boundaries and learning through trial and error. And maybe also developing their own anxiety because they are taught that the world is a scary place. So I'm really curious, based on your childhood experience, would you want to replicate that for your own kids? Do you think that's important, or do you think there really is a merit in terms of being perhaps a little bit more safe and conservative these days?
It's such a hard question, and I really wish I was better at it myself. Because, like, even things like the playground, which is pretty safe for like my son's like 4.5.
Uh-huh.
The playground's pretty safe, and I just like have these images, of him just like falling down and
Right,
like.
right.
But recently he it was in a play area. He just jumped off a beanbag, in like the most padded area, and that's where he like split his tongue open.
Oh man.
Right. So it's like so hard to predict when these things are going to happen. And I think just like with all anxiety disorders, you're going to take your best guess as to what's like your due diligence,
Hmm.
right? Like what is considered like proper precaution and what's beyond that.
Right.
And it's you want to do it as close as you can to be based on data rather than your emotions, because like as a parent, you have such powerful emotions. Like the love you feel for a child is like
Mm,
unparalleled, and you never want to see them hurt, and you hear them cry, and it's like gut wrenching.
right.
So like you really want to keep them safe. And I think that could be just like with all safety related concerns, you could take it too far.
Sure.
And like I actively need to just let my kid make mistakes. Like he has to fall, and also you have to just take your best guess as to what is proper precaution and what's beyond that.
Totally. Do you think though, as a society, right, in 2021, that we have erred too far, right, in terms of like safety and conservatism? And because I had a very similar experience, growing up. My parents' rule was just come back before dinner, before it's dark outside, and there's no phones, and they trusted us to go ride outside. But on the other hand, obviously, yeah, maybe the world is not a safer place. There weren't school shootings as much as there were, as it is growing up. So I'm kind of curious if you feel like it is, to your point, is it evidence based? Is it data based? The level of precaution that we're seeing, or are we seeing sort of I don't know, a societal anxiety that's gone too far?
Right. I do think we did go too far in terms of the overprotection. I think certainly in the social media era,
Hmm.
we're so exposed to you know, all hyped stories. And, I just think that because of this, exposure, like we're so interconnected,
Mm.
and tragedy just gets way much more coverage, and kidnapping gets way much more coverage than like a kid had a fun time in the backyard.
Yeah, yeah.
So I don't think it's backed up in data the amount of caution that we have. And I think there, especially the fact that we do have cell phones. I think instead of letting that, I think that could be a reason why you could be more trusting. And I think you also have to know your kid,
Yeah.
right? Like I think some kids take advantage of those freedoms. Some kids are like, should be watched better. And, it's often the kids who are watched very, very carefully who don't need to be watched as carefully.
Fair enough.
Yeah, but I do think we need to loosen the leash a little bit on our kids.
Yeah. And I almost think like we're seeing a little bit of a backlash against this. I don't know if you saw a few years ago, maybe it was like 2012, there was a book that was published called The Dangerous Book for Boys. And it was, it's like a guide on like how do you tie knots and do all these things, go outside and, scale a fish and do all kinds of things. Weren't necessarily dangerous, but they were, I would say,
Right.
adventuresome. And it ended up being a bestseller because I think a lot of parents nostalgically look back upon their childhoods, all the things that they did, and they're like, oh, it would be a shame for my children to at least not know some of these things. So yeah, maybe there's a good point there. The other question that I was curious is, you mentioned having a lot of this freedom, and then, you went off to college, right? And I almost see the opposite phenomenon. There's a lot of, teens and kids who are very closely monitored by their parents. And then when they go off to college, they have complete freedom, right? And they almost like abuse it because they've never had to, non-supervision, and without limits. So I'm kind of curious what you think about sort of that dynamic, and if your observation of that. Do you think it's better to like almost overprotect them and then they'll figure it out on their own when they go to college, or do you prefer like more freedom pre-18 so that they don't go crazy and like binge drink and do crazy stuff when they have freedom as an adult?
Yeah, well, as far as my own experience, I started college 2 years later. I actually went to seminary in Israel for 2 years
Oh
between
wow.
high school and college.
Yeah.
So high school, I was kind of like a mess. I almost didn't graduate. Like
Yeah.
I just like wouldn't show up.
Yeah.
Um, and then, I think I did sow my wild oats and I got it out of my system. And I
Yeah.
think, the Israel program that I was in was very into like character refinement and responsibility and how learning is cool,
Yeah.
right? Like it's actually cool to know things, right? Rather than, and ignorance isn't cool. So I think then I went to college and I realized how much wisdom there was out there. And I
Totally.
actually like appreciate it. So I think there's definitely something to be said about starting college later.
Mm-hmm.
Like I don't know what the rush is that, you have to start college at 18 when your prefrontal cortex is still like still like so underdeveloped,
Right.
right?
Yeah. Especially for
And
guys.
yeah, so I think like these programs could be very helpful, whether it's like a gap year or studying, um, or like some kind of volunteering service. I think there's definitely something to be said about waiting until you're a little bit more mature and you know yourself, and
Mm.
rather than just like, oh, now I can finally drink until I don't remember anything.
Totally, totally. Well, this is fascinating, though. I have to say, and this is why I love doing this segment in terms of getting to know people. When you see very successful professionals like yourself, you've done a doctorate degree, done postdoctoral fellowship training, you run a successful private practice. You don't imagine that you're someone who, in school or high school was someone who would get in trouble or not show up.
Yeah.
So I have to ask, right? So about this sort of this transition or maturation, perhaps, right? So how did you go from being sort of a little bit of a troublemaker in school to all of a sudden deciding to go to seminary and doing this program? Like, what was the thought process that was involved there?
Right. So in the Jewish community, it's not uncommon
Mm.
that kids do this gap year between high school and college.
Hmm.
I actually did it for a second year. So it's also like really fun. Like you're in a different country, and I think you kind of get it out of your system when the stakes are lower. I mean, you're not jeopardizing your college career
Right.
if you're making a joke out of it. So it's just um, part of the zeitgeist in some Jewish communities to go to Israel for a year or so.
Yeah, makes sense. And then tell me about the character development part of it, because it sounds like it had a kind of a positive benefit, for you. And what do you think was effective, whether it's in that program or potentially if people are taking a gap year on their own, that, helped you kind of grow up a little bit?
There was a lot of volunteering opportunities.
Hmm.
I was like in a Big Brother program, which
Hmm.
was really cool. Um, I think there was a very, very straight up, they call it Musser. Have you
Hmm.
ever heard that term?
No.
But it's basically just lectures on character refinements about being a good person. And it almost was like a culture of people really caring about being a good person.
Hmm.
And you had really very loving teachers and a very friendly environment. And it was just based on these, you know, just based on character refinement and
Yeah.
also Jewish learning,
Hmm.
which is like very, very heady,
Hmm.
like Talmud for like multiple hours per day. And
Yeah.
that is like such an amazing exercise in intellectual acrobatics.
Yeah.
And, so the cool kids were the ones who were like really had it together, and the
Mhm.
kids who were really, really smart and knew it the best.
Yeah.
So I think just like in terms of what's considered cool in high school, was the kids who were like really popular and who were going to all the parties. And in Israel, it was the kids who were really smart and
Mm.
really kind. So I think so much like having role models is a really important factor, because
Totally.
we're humans. We just like to do what's cool, and if
That's such
being
a
nice is
brilliant lesson.
cool, yeah.
Yeah, because I can imagine like if you're a snot-nosed 18, 19-year-old and you're getting lectured about character, you could see it very easily like going over people's heads. But I think because of the context that you describe, right, where it's not just that there's some adult telling you how you should be, like it's almost like a dare program in the US, but it's almost like there's a peer reinforcement, right? That yeah, if you actually act with character and dignity, then that is admired and you want to emulate your peers. I could see how that's actually very powerful. Do you think it's possible to recreate that outside of a very strong spiritual or cultural context? Like if someone, let's say, took a gap year here in the US and they decided, I want to also volunteer, right? I want to do Teach for America or these other sort of gap year programs. Do you think it's possible, or it really takes that close knit community to make sort of character development work?
I think it could be replicated. Like I think like if there was a I don't know, maybe there is, but if there was like a Boy Scouts,
Mm-hmm.
Boys and Girl Scouts of America, if they had something between high school and college, I think yeah, I feel like there is more and more like a thirst for wisdom, like in this whole podcast era,
Mm-hmm.
where people like will just listen to hours of information. And really, I feel like people are thirsting for wisdom in this ultraviolet times,
Yeah, yeah.
where everything is so, so loud. And I think there could be I think there should be, and I don't think it needs to be in the context of religion, but something bigger than yourself. And I think volunteering is a great example
Mm-hmm.
of something bigger than yourself. Um, I
Absolutely.
was thinking like it's very easy, especially as a teenager, to get very nihilistic and
Yeah.
like, what's the point of all of this? Like you're learning and you're coming to grips of our own mortality and like the fact that life is limited, and it's easy to think that nothing really matters. I remember like a very powerful thing someone told me was like, what's certainly real
Mm-hmm.
is the pain of other people,
Mm.
right? And your
Mm-hmm.
own pain. And there's nothing more meaningful that you could do as a human than to relieve the pain of other people.
Mm-hmm.
And even in like the most nihilistic place I've ever been, like that rang true to me as someone
Yeah.
who's felt pain in his life.
Yeah. That's such a great point too, because a lot of people, especially I think young people who might be feeling that pain and struggling growing up, it is very easy to fall sort of into nihilism or depression. But ironically, I think if you have your own personal experience with pain, you could use it as a point for empathy, right? Because it's like, oh, I know what it's like to suffer, and I could see that in other people as well. Um, and yeah, maybe it becomes a point of leverage to do something about that, whether it's big brothers, big sisters, right? Volunteering in some other way. I think it's such a great lesson from your own sort of upbringing in terms of sort of, what made you who you are. So
Yeah.
I'd love to hear the continuation of that. So okay, so you did this program in Israel, um, started college. Tell me like kind of going through college and kind of how you decided how that experience was and how you decided to pursue grad school and become a psychologist.
Yeah, it's a really good question. I really didn't know what I wanted to do for such a long time.
Mm,
I have an older sister who's a clinical psychologist, who's
hmm.
actually a psychodynamic
Cool.
clinical psychologist, and I kind of went the other way.
Yeah.
But she got me into Freud a
Mm,
lot. Like, and I read The Interpretation of Dreams. And that was even in high school, and I was really into like trying to understand people on a very deeper level.
Yeah.
And I think Freud had some really cool ideas about like what's really going on
Mm-hmm.
under the surface, and whether or not that's all true is, you know, I don't know how much research is behind all of his ideas,
Sure.
but I really just like this idea of like being able to understand my friends on a deeper level.
Yeah, yeah.
Right.
So I have to ask. I have to ask on this,
Yeah.
especially because you didn't sort of pursue the type of psychotherapy that's kind of evolved from Freud's tradition, right? And psychoanalytic
Right.
psychotherapy, if people are familiar with it. But I feel like Freud gets a bad rap these days, right? People kind of knock Freud for being totally wrong, and obviously he's a product of his era. But do you think people should study or read Freud? Does he still have value in 2021?
I do think so. I definitely shouldn't sit here pretending I'm like a Freud scholar
Sure,
because
of
I
course.
definitely didn't give him much time beyond high school and beyond like my early, kind of like the history of psychology.
Right.
So I do think he contributed a lot in terms of just this idea that you could talk to someone and it doesn't have to be, medical interventions. Like there's such a thing as talk therapy. That's huge,
Right.
right? And I think there is something extremely deep that we can't see
Mm-hmm.
that he tapped into. But I think in terms of practically, and especially in the area that I work on, like OCD, so many people spend so many years in treatment just like discussing like what's underlying these intrusive thoughts, right? So I get so many people after they've been years of psychodynamic or psychoanalytic psychotherapy who like made very, very little progress. And in the course of just really just a few sessions, you see such major transformations. So I think it has a value. I think maybe I'm just biased in terms of the area that I work. That's just so conducive to cognitive behavioral therapy.
Sure, and I think I'm probably pretty philosophically and clinically aligned with you. But yeah, it's a good point. I think people take for granted that, especially back in the era, there was no talk therapy. You kind of invented it for all intents and purposes, right?
Yeah.
And even major notions like that we have an unconscious mind, which we take for granted, are definitely major contributions. So yeah, it wasn't right about everything, but very, very influential and probably worth studying. And obviously his protege Jung as well. So you're kind of going through college. You don't know exactly what you want to do with your life. You did have one of your own role models, obviously your sister. But what kind of made you decide to take the leap and pursue this path?
Yeah. So while I was in college, I actually worked at a home for individuals with developmental disabilities and different psychiatric conditions. I have an older brother who's a medical doctor, and I was kind of deciding between medicine and like of my older brother and psychology of my older sister. And working in the group home, I really found it just so amazing how much capacity you have to really affect people just using talk and really being able to make the type of changes that are so meaningful. Like I think it's very easy to get, I think a good way to put it is like if you have physical health, right, without mental health, like, what's it for?
Exactly.
So I feel like it really took people to the next level of like being able to really thrive in their lives, being able to get past extremely challenging circumstances. And I found that, psychotherapy and talk therapy really helps bring people to that next level of not just being alive, but like enjoying your life, which I thought was a great role to play. And I didn't go straight into clinical psych. I actually took 2 years off to just figure it out. I guess I have a 2 years thing.
Yeah.
And
What did you do during those 2 years?
I ran marathons.
Amazing.
Yeah, and I continued working in the group home.
Hmm.
So I had a job, and just from working on the weekends, I was able to support myself and
Hmm.
try to just figure it out. And I got health insurance, which was huge.
Sure.
And and then I applied to grad school. I didn't want to just go into it because I was a psychology major. I actually wanted to make sure that this is what I wanted to do,
Yeah.
and then I just made it happen.
I think that's such a valuable lesson for all of our listeners. I get asked for career advice all the time from people, whether it's to pursue psychology, medicine, any other field. And one of the things that I recommend is try to spend some time shadowing or working in the field as much as you can, even if you can't do it directly. Like, you obviously can't practice psychotherapy without a license, but you absolutely can volunteer. You can do assessments. You can work in a group home. And I think it's very eye-opening, right? Because the idea that people have about what it's like to be a doctor of any sort is very different than the reality, right?
Right,
It's not the Hollywood, stereotype from Sopranos, or I don't even know where people get their notions from.
right.
But yeah, people, my experience, when they go do work in a clinical setting, they either sometimes fall in love with it and they know it's the right thing for them to do, or quite frankly fall out of love with it and they're like, oh, I don't want to be a dentist or do whatever, for notions that they couldn't even anticipate, which is like, oh, it's like you got to crouch over all day, and this is not like, it's like things that
Right,
you,
it's
you
the
can't
little
even
things.
anticipate until you're actually doing the job and getting your hands dirty,
Yeah,
and you're like, oh, okay, I like this or I don't like this, right?
right.
So I think some of the questions that people are like grappling with, we actually had someone in our community ask about sort of career transitions. And you can give a lot of advice and frameworks for how to think about career decisions, but to some degree, if you have a notion, yeah, try before you buy is not a bad way of going about it.
Yeah, it was a great experience because like there was even behavior plans, and you really got to do much more than, a lot of people will do like, if they're going into research, then research is a great experience, but you have to do research in order to get into a clinical psych
Right.
program. So the group home was a great experience of like getting to really understand behavior plans and how they work and implementing them and working with psychologists. So it's definitely a great experience.
Amazing. And then, so you get into grad school, and then now you have to go through this gauntlet, right? You have to, do a doctorate, do a dissertation, do an internship, do a fellowship. So tell me a little bit about what that experience was like, because it's not easy to go through the many years of training to become a doctoral level healthcare professional, and also why you decided to specialize in OCD of all things.
Yes, great question. So I happen to have gone to an awesomely supportive and even fun clinical psych program.
That is a rarity.
Um,
So
I know, like everyone was just so real,
yeah.
and it was just the professors were all supportive, and it was intellectually stimulating. It was just such a really great experience. I mean, it was definitely difficult, the coursework and the research, your master's thesis and your dissertation.
Hmm.
So it was jumping through a ton of hoops, and you get really good at applying for things, right? Like you're applying for externship, and then you're applying for the next externship and internship. It probably wore down like, that binder that you bring on every interview.
Right.
Like it's probably to a nub. Uh, but there's just a ton of hoops to jump through. And, to have a supportive environment like,
Mm-hmm.
that I had in grad school was like really indispensable
Hmm.
and really made all the difference. And there was also like a lot of different options in terms like allowed you to go into the clinical direction that you're interested in.
Yeah.
So there was a acceptance and commitment therapy lab. There
Mm-hmm.
was a dialectical behavior therapy lab.
Hmm.
There was a parent-child interaction therapy lab. So you had so many choices of the population
Hmm.
that you wanted to work with and the therapeutic modality that you wanted to work with.
Hmm.
And so for my second externship, I was at a OCD specialty practice in New York City called the Reed Center. Okay. And I think, what I fell in love with is how conducive the condition is to the treatment that we do, right? So exposure therapy, like of all the treatments that I've done, whether it's dialectical behavior therapy or working or whichever diagnoses that I've worked with, like depression or bipolar disorder, OCD and anxiety disorders are so well targeted by behavioral therapy. And I know that I have a deep desire to be an effective person and to see change in front of me. Right. And it's probably, selfish in a way because like, I really want to see that change. Like, I do have patience with the C, but I just love seeing those changes in front of you and people telling you like, wow, I didn't know that I could do this. For like 20 years, I haven't, gone outside to a crowded area. And then I tried it and look, I could do it. Wow. So just like being able to give someone that on a regular basis is so rewarding. And I just fell in love with that.
Tremendously. Yeah. And, I think that also helps dispel one of the other notions that people have about therapy. There's this classical stereotype that, people just kind of go to therapy forever. Clinicians try to keep people in therapy forever. And I'm like, it's actually nothing further from the truth, especially if you're kind of more of a behavioral therapist. The conditions like OCD and other anxiety disorders are the closest things to being curable, I would argue, in the spectrum of psychological conditions. And often, 8, 12 weeks, 16 weeks, you can see not only remarkable improvements, but like night and day differences in functioning. And it is tremendously rewarding. So it makes tons of sense why you decided to, pursue that path and kind of specialize. And so, when you finish your training, you're getting licensed. I'm sure you had a lot of different options, especially in the Northeast, in terms of where you could go. You could work in a hospital, a community center. Tell me about how you kind of decided about where you wanted to apply your energy in terms of the setting.
You mean like for my first job?
Yeah, your first job and how you ended up even in the place that you are now.
Okay, great question. So I really honed my skill of treating OCD very deliberately, to the point where I felt after my postdoctoral fellow that I had enough experience to go on independently. I didn't know how to start a private practice. Like, I listened to a ton of podcasts, and I was always also very interested in entrepreneurship. Yeah. And like, I really liked the relationship between risk and reward. And, if you work harder, you get more reward. And if you work less hard, then, you get less reward. And I find that extremely motivating. So sometimes if you have a 9 to 5, if you do amazing therapy and you see a ton of patients, you end up with the same paycheck. And I really like this idea of building something, and having that freedom and flexibility to just do things the way you want to do it. Yeah. And so I just, straight from postdoc, I started my private practice.
That must have been a little intimidating and scary. How did you overcome your own sort of anxiety and like, hanging up a shingle and making sure that people are actually coming in?
So how did I do that? Let's see. Well, first, I have an amazingly supportive wife.
There you go. That's critical.
Right, 100%. So both emotionally and materially, like if I didn't have health insurance through her, it would have been much harder. And I probably would have just done it much more gradually. Yeah. But I recognize that, there's a formula to getting it right, and there's such a demand. And if you just do really good work, and you work with integrity, and you market with integrity, and you speak to every single person that could possibly you just make these connections and people refer to you and you just make it happen.
Yeah.
And I want to make it sound easy,
Right.
because it took like 6 months to be able to
Mm-hmm.
actually have a practice going.
Sure.
I remember like I started in October, and like, things that first Thanksgiving, like there was like no calls. And
Yeah.
I remember just like thinking like, did I make the right choice over here?
Yeah.
And I had this really nice clinician in the office next door, who was a marriage and family therapist, who was just so supportive and said like, this is not the time when people start therapy.
Yeah.
Don't worry, like you're really great. And she was just so kind. And you should never underestimate what a few words could do for another person who's having a hard time,
Yeah.
because that really gave me the confidence to just keep going in it.
Yeah.
And to this day, where I have a full schedule and two full-time and a part-time clinician working with me,
Amazing.
that really got me there.
Yeah. That's such a great lesson, by the way. It's funny, if you actually look at the research literature on psychotherapy, a lot of the benefit actually comes from the first couple sessions, which is kind of paradoxical, because you haven't done a ton of exposure yet or taught sort of cognitive skills yet. But I think it really does come from the installation of hope, as you said. Like, just to sit someone down and say, hey, look, you're not crazy. What you're experiencing, yeah, maybe it's kind of gone to an extreme, but it's certainly not abnormal, right? This is what it's called. This is how we characterize it. We can treat this, and I'm optimistic that you will get better, and I will help you. Those words are very powerful for people, and that even before they're even better, just the notion that you can get better and that you no longer have to suffer, I think, can definitely lift people's moods, right? It instills that hope and optimism that I think we all need.
Yeah.
And it's an interesting thing listening and hearing this wonderful story of your life. There's such a theme that cuts across it, which to me is support, right? You mentioned the support in seminary, the very supportive graduate program that let you pursue your interests, supportive wife that let you go off into private practice, and supportive colleagues, right? That gave you hope that you can flourish and be successful. So I really just wanted to point that out to all of our listeners here is, and this is why I love just digging into people's life stories. It's so easy to see someone who's a success at the end, and we apotheosize them, and they're like, oh, it's almost like the great man myth,
Yeah.
and we don't sort of see all the support that they got along the way. And it's so great when you talk to people, especially people who are immensely successful. They often, with great humility, like yourself, attribute part of their maturation success to support. So I think that's a great lesson to everyone listening, is it doesn't have to just be on your shoulders of like, okay, you got to will your way to success through pure motivation and willpower. Yes, in the end, the responsibility falls on you, but there really is something to be said about finding supportive partners, colleagues, or environments that can enable you to flourish as an individual. So don't think that you have to sort of do it alone. And in fact, it's probably better if you don't. That's also why we literally created an online community for guys as well, so that they don't feel like self-improvement has to be done by themselves. They can do it, with the exact social support that you're describing as well.
Yeah. You got to be very mindful of the people you surround yourself with, because people could really cut you down, and people could really help build you up.
Totally. And on that note, we often talk about the idea that we're shaped by the 5 people that we spend the most time with. I'd love to hear who were the most kind of influential male role models in your life.
Okay, cool. That's a great question. So I think, in terms of like a primary role model, my father was always a huge role model in my life. Um, so he wasn't a very materially successful person, but he was an extremely hard worker. And he is actually a Holocaust survivor.
Wow.
And so his father, so he was born in 1940, and his father was like a partisan. And when the Nazis invaded Poland, where he was born, like he took his family.
Hmm.
My grandfather took his family into the woods,
Wow.
and they lived in the woods for like 2 years, like through the winters in Poland.
Jeez.
So he always really instilled this message in me, like of what it means to be a survivor,
Yeah.
and how ultimately, we could have our support, but almost like you said, there's so much that life throws at you, and you could transcend that.
Hmm.
And there's never like a point where you could just give in, like you
Hmm.
just keep on moving forward.
Hmm.
And I think that was a really powerful message for me. And I
Hmm.
saw it in his own life. Like he was an extremely hard worker.
Hmm.
He never went to college,
Mm.
but he worked a job and he worked his way up in a nursing home.
Hmm.
And then at night, he was a maitre d' at a wedding hall.
Hmm.
So he'd get back at 2 o'clock in the morning. I remember like he used to just check in on me. Like sometimes I'd be awake and he'd just like kind of like just very proud of his family after working till 2 in the morning. And he always came home with like the best leftovers from these weddings,
Nice.
like a huge pan of like sesame chicken. But so I think he's an amazing role model of just like working really hard and what it means to survive no matter what and to protect your family.
Yeah, I mean, I can't imagine. I mean, that is some of the most difficult stories, we've ever heard as a people. I'm curious, like, what do you think that made that effective for you in terms of transmitting it? It's very easy, I think, for parents to tell stories about the suffering and hardships that they experience, and but for the kids to feel it, right? Because they didn't maybe live through that experience themselves, or maybe they were too young to remember it. And so it just seems like a faraway story or almost fable, right? They believe it, but it's hard to like grasp that reality when you're sort of safe and secure in your better life that your parents sacrificed for you. But what do you think it made that effective for you, that it did hit home for you and did feel sort of powerfully resonant? Was it the fact that he lived it and embodied it by working hard, or something else?
I think it was so alive in my household.
Mm,
Like he definitely had, you know, how trauma transmits through generation, and I think he definitely had, or he's still alive. He he definitely has some remnant trauma, and I remember like as a kid, he would tell me like, eat your food fast because if you do, no one can take it away from you.
geez.
So he like embodied it. And
Yeah.
even recently, like we were going on a road trip, we were just like driving,
Hmm.
and he would point out like which woods are the good woods to hide in,
Interesting.
right? So it's definitely like alive and real to him, and as such, it was real to me. And I think I really felt it the most when I became a father myself, and I would think of like how careful you are about the comforts of your child.
Mm,
Like you're going into the room to make sure like the temperature is not 74 and too hot, or like 68 and too cold, right? You want to, and I'm thinking like, damn, he was sleeping in the snow,
yeah.
right? And yeah, so I think it was something that there was definitely a tremendous amount of pain that I saw, so it became very, very real
Yeah.
to me. Like he lost his sister,
Mm.
um, running through the woods. They just had to keep on running, and so he definitely sacrificed a ton. So just like seeing his pain,
Yeah. Yeah.
I was also always very proud of him. Like he used to give presentations to my classmates, like in third grade. Like you
Yeah.
really learn about this when you're very, very young. And I was always just like so proud, to be a first generation Holocaust survivor,
Yeah.
and that he did that all, and he was still able to like come to this country,
Hmm.
and like build up a family.
Right.
It was something that I was even impressed with in the third grade.
Totally. What an incredible story, and what an incredible dad that you had that is able to live through all that and transcend it, and pass on some of the positive, along with the challenges that all came with. I think
Yeah.
that's also a very powerful story too. Is some of us are very fortunate to have positive male role models, especially father figures in our life. Unfortunately, in American society, sometimes that's lacking. But I do think actually that's the power of stories, podcasts, and books is you absolutely can actually find role models vicariously. And there is actually value, I think, from hearing other people's stories and drawing inspiration from it. Actually, one of my favorite books is called Man is Wolf to Man, and it's actually an account of a Jewish man who survived that time period in Eastern Europe, was thrown into a gulags actually in Russia, survived it by pretending to have some medical knowledge and being like the assistant to like the doctor in the camps, which is how he survived it. Escapes, immigrates to America, actually goes through medical school and becomes a very prominent like head of surgery in Iowa, and lived a very like nice life after that. Would go to the country club and play tennis with his wife, but like nobody knew this crazy story that he lived through, and until he published sort of his memoirs, people sort of couldn't believe it. But it's an incredible story of inspiration and overcoming adversity. And I think even if you or your family didn't live through it, you can draw inspiration and certainly gratitude from what happened not even that long ago, one generation ago.
Yeah.
So if you don't, that's hopefully the lesson to our listeners. If you don't have them directly, you certainly can have them vicariously. And I think that's actually why biographies and movies are actually not a waste of time if they do present good archetypal lessons and role models. So, and I think it's universal. You see kids running around with their favorite, athletes' jerseys or posters on their wall. And it's truly a universal phenomenon. At first, I didn't really understand it. I was like, why do people, want to be someone else almost? But I think it's almost like an imprinting or modeling that's happening in terms of trying to figure out, as you try on different identities, who you want to be and what characteristics or qualities or virtues that you want to learn from other people who in 10, 20 years time, you may be like them.
Yeah. That's an awesome point.
Um, hindsight is always 2020, but a fun question that I like to ask, and I'd love to hear from you, is if you could almost like go back and give advice to your younger self, what would you say to your younger self? Even and what age would you even give that advice?
Great question. So I think I had a hard time in elementary school with this idea of popularity. Like I definitely wasn't a popular kid. I was overweight, and I had a hard time. Just girls weren't into me. And I think an important lesson it would have been nice to know is that like popularity is not so important, and like just be grateful for the friends that you have.
Mm-hmm.
And that one day you'll meet an amazing wife. Don't worry if like the pretty girl in school doesn't want to look at you.
Totally. Yeah, it's so funny too when you look back upon it. Like, funnily, like from a very illogical point of view, you're like, what does it even matter in elementary school anyway? The likelihood you're gonna seriously date anyone is slim to none, or obviously end up with that person. But yeah, in the time, just because of peer pressure and other things, it is tremendously important, right?
It's such a status symbol.
Yeah, right. But in the moment, we don't have that kind of forward-looking point of view. Hopefully, that's why you have older brothers or fathers who can maybe distill that. But that is definitely a powerful lesson. And on that note, a great also book recommendation, if people want to dig into it, is this book that's also been a popular seller called The Courage to be Disliked. Is actually one of my favorite books, and it's very much along those themes. It's not to be unlikable. That's obviously not the goal. I do think you should try to be agreeable, obviously have good relationships with other people, but there is a merit, I think, in terms of being willing, especially if it's standing up for yourself and your values and doing the right thing, that may require you to be disliked, at least in
absolutely.
time or context. And so I do think it's useful to have that sort of courage.
I could definitely use that. I definitely find that I try to be liked by a lot of people. It's very important for me. So I should practice being unliked.
true for all of us. I think it takes a lot to go against the grain.